right into our case presentation, which will be presented by, I think you were muted, so you just need to hit *6 to unmute yourself.
All right, can you hear me?
Yes.
All right, wonderful. So we are presenting on a 79-year-old female who does have some local family, a husband, a couple sons, and a daughter-in-law who are kind of in the picture. There are some history of, social history for the consumer, such as being unstable. There's some potentially unsafe situations in the house, history of alcohol, potential domestic concerns and such that we'll review. So there are some significant social items to consider. So like I said, we have a 79-year-old female patient who has advanced dementia. She lives with her 81-year-old husband in a house that they both own. They both have anxiety and depression. They have 4 adult sons. 2 live locally and have been involved with the caretaking along with their partners. Of the 2 others, one son lives in New York, is involved a little bit, and the youngest son lives in Arizona and has minimal contact with the family. The situation with the patient has declined in the recent months. The sons report that her behavior has become more upsetting. Examples include her walking around the house naked, forgetting how to use the bathroom, soiling herself around the house, sundowning in the evening, increased agitation, and sometimes seeing people who are not there. She's also wandered in the past. Since this has occurred, the family has not left her alone. The husband becomes upset at her behaviors and yells at her with fights that frequently occur. The sons are upset that their father is not handling things in a more delicate manner. The husband and the patient have been declining all services offered to the family, which includes ServiceLink, home care services, senior companion programs. The husband and the 2 sons that live locally have discussed nursing home placement, and the son that lives out of town does not agree. The husband requests to visit local nursing homes to see what the routine would be like, to get the atmosphere. 3 visits have been set up for the husband with social worker at nursing home, but then the husband has canceled the appointments. And this has also happened with other such appointments too, where there will be somebody lined up for services to come in or to go out to the physician, and then the husband will cancel. So ultimately what we're looking at is how can we help this family before things deteriorate further. And would you like me to go over the incidents that have occurred?
I think that would be great. Just,
Okay.
sort of, and maybe summarize.
Sure. There was one in which so at the end of January, the police were called. The husband reported that the patient was in one of her moods. He was trying to get his wife to, quote, shut up. The husband pushed his wife and she pushed back. He fell and had hit his head on the radiator and was unable to get up. While he was down on the ground, he thought that he had heard the front door open, and it was also snowing out at that point in time. So when the police were called and they did a search, they ended up finding the wife hiding in a closet in the house, and it's reported that the husband had been drinking. So that's, one situation that, we have. So that's where, we say that there's some domestic concerns that are going on within the house as well. So primarily with the husband drinking and being unable to manage his wife's, dementia. So apparently this has been going on for over a year. It's big for the community in the sense that, you know, there's not a lot of resources, and the resources that are available are allegedly being sabotaged by the husband. And issues or other impacts that are affecting the community are police involvement in hospital visits, in which they're tying up local services that might not necessarily need to be tied up in that capacity, in which it could be used in other parts of the town. You know, and this has been going on for, you know, upwards of 6 months or so. So it's definitely concerning, you know, for the frequency of the residents. So with that, I kind of you know, open it up to the floor as to different different, you know, how do we manage, or what are different options for this individual, maybe to assist with the husband to allow for services and such.
I have a
Excellent.
question.
Okay, great. Let me just follow the protocol. I'm just going to summarize, Jeff, that your question presented is, what are strategies that can be used to help a family accept needed services and supports in the face of difficult family dynamics and resistance to help? Is that a fair assessment of the question?
Yeah, no, absolutely.
Great. Perfect. So then what we're going to do is, just as a reminder, we're going to go to our spokes first to ask for clarifying questions. So please go ahead.
Hi, this is Sharon. I was wondering if you had male service coordinators, male clinicians, and what gender is actually dealing with a husband?
That I'm not certain of who is actually working with the husband.
I can answer that. This is Bridget from Coos County Family Health. Yeah, both the patient and the husband see separate female providers. And the husband recently started going to counseling, and that's with a female provider. So our behavioral health components that we have embedded in our primary care they're both females. And right now, both the husband and patient are seeing female providers.
Great.
Hi, this is Leslie.
Go ahead, Leslie.
This is Leslie Furno, and I just wondered if there was any concern about his capacity actually to be the caregiver. I mean, of course, he's got, it may differ depending on whether he's been drinking or not drinking, but has that been addressed?
This is Bridget again from Family Health. I know it's been addressed with the husband from his primary care provider. But there's been some, with the sons, there's 2 sons locally, and they've been providing some of the care along with the daughter-in-law. But there's some conflict with the sons because some think long-term care is appropriate, and the ones that live a distance away are not in agreement to that. So there's a lot of conflict there. So it has been addressed.
Great.
So
a couple of,
oh,
sorry, just
okay,
just one quick note that if you haven't already signed in to the chat, they want to make sure that people let us know that you're there. So go ahead, ask the question. Sorry about that.
That's okay. This is Sharon. So I'm wondering if there was a behavioral history that was taken in terms of how the 2 individuals communicated with each other, how they responded to one another, because my concern would be that this behavior of hiding in the closet is not a new one.
So I know a little bit of the history with the husband, but not so much with his wife, only because he's been receiving counseling and she isn't. So I know that he has a history with his mother had Alzheimer's dementia, and there was issues when I know that there was some family dynamics then with him. So he has a little bit of trauma related to some stuff that went on back then. And I believe there might be some domestic, there were some domestic issues with his family too growing up. But I'm not sure about the patient.
There's a couple of questions that have come in from the chat. One is, has Adult Protective Services been called?
Yes, and they are involved.
And I was also curious, I don't know, this is Carol with Elder Abuse Institute of Maine. I was also curious about how the police responded and what his reaction was.
Ooh, I don't remember. I know that the sons were upset with him that he called the police. But I don't know what his reaction was when the police were called. I just know that it caused some conflict between him and his sons because the sons didn't feel that it was appropriate that he did that. But he was worried because he couldn't find her, thought that she left.
He was on the floor.
Right.
But he called the police when he got up, right?
Right. He called the police when he got up, when he was able to get up.
Carol, did you have any other questions before we move on? No. Okay, good. There's another question about, is there a payer source for long-term care placement?
Oh, no.
They haven't applied for Medicaid yet.
They haven't applied for Medicaid yet, and recently they own their own home and they had their furnace let go, and we were trying to get some services in place to help them get a new furnace through Tri-County CAP, a whole bunch of different things, USDA, and they didn't qualify because they were over income. So I don't know what the Medicaid, what will happen.
Not that we would even want to develop the information.
Right.
This is Diane. It sounds like they're pretty private people, especially when it comes to their finances.
There's another question about, is there a medical power of attorney, and if so, who is that person?
Okay, so this is a big, we don't know because the husband is telling the primary care office that there is one, but we don't have a copy. But when they go to the ER, they tell the social worker there that they don't have one and they want a complete one, which can't be done because she's in advanced stage of Alzheimer's. So I've talked with the daughter-in-law, and the daughter-in-law says that there's not actually an advance directive, but there's some kind of like piece that gives the husband, the authority, which I haven't seen any of that paperwork. So it's in question whether there is one or not.
Yeah, no, I can't find any paperwork.
Another question that's come in through the chat is the integrated behavioral health clinician addressing his alcohol use?
Yes. He just had his first visit last week. So he's only, he's been once. So his initial visit was last week and it was addressed.
I'm going to offer both of these questions, which are from different folks. So one is the husband's counseling providing education for him to understand dementia and what her behaviors are in relation to communicating and other issues? And also, have the adult sons received any similar type of education?
Good question. I'm hoping that that's going to be addressed and that the husband continues to come in and see the counselor. I think it's set up on a weekly, every week or every 2-week basis. And then as far as the sons, none that I'm aware of. One of the sons actually works for ServiceLink.
Yeah. Just did.
I'm taking a little pause from the chat room to see if anyone else has. I'm actually going to shift over to questions from our faculty. So faculty, feel free to start asking questions as well.
This is Ellen. Has there been a family meeting to try to get everybody in the same room and on the same page? Or at least the same level of understanding of what the behaviors are?
No. No. Yeah.
And there's no home, not like a visiting nurse that has a social worker that could go in and do a family meeting at the home. That would be something that would have to be done at the PCP's office, and it's 2 separate PCPs.
Yeah, one of them would have to take some control of the situation and take it on.
Anne Marie has asked, has a referral been made to REAP?
They refuse.
They refused.
Yeah. She refuses everything.
Look, they're refusing any kind of in-home services.
They did have the services briefly when she was hospitalized last summer. Remember we were talking about that? But I think they were in there for 1 month and that was it, and then she wouldn't allow them to come back in again. They both had a hospitalization around the same time last year. We were able to put a visiting nurse in for a short period of time, and then that stopped within a month.
And just to clarify, Ruby Baker from Cove in Vermont has asked, and she said maybe I missed it, but I don't know that this question has been asked specifically in relation to the potential domestic violence history. Was there any history, demonstrated history before the dementia set in?
I'm not aware of any domestic violence before the dementia set in.
And another question from Leslie Furno, and by the way, you guys can, you don't have to type it in the chat. This is the whole point of this, for you guys to have interaction. So I'm, if you can unmute your phone and ask the questions, that's better. People are going to get tired of listening to me. So if you know why, have they given a reason for why they have refused home services?
So, good.
Well, she gets really, really agitated when anyone comes to the home. And I think it causes him more problems when that happens. So then he will refuse them because she gets so upset and agitated when someone comes into the home.
Well, that's the problem.
This is Cliff Singer. Can I jump in?
Please, Cliff.
Yeah. So Let me just ask a couple of questions about her. Do we know what the cause of her dementia is? And therefore, do we know whether it will progress and what her lifespan is?
I know she just recently had a consult in Dartmouth, and they did testing, and she's had that in the primary care.
Okay. All right.
I think
And you say that she has advanced dementia. Can you describe her level of function a little more for us? And what in the world do they talk about when she goes to counseling?
So she doesn't go.
Oh, she doesn't
Just
go.
him.
Just him. Okay,
Yeah.
that's amazing that he agreed to go. All right, I thought that she was in
Right.
counseling too. Okay, but can
No,
you?
and it took a while to get him to agree to go to the counseling. So that's been ongoing conversations where he agreed to do it. And I think that was recently, probably in the last month. So I think after that incident that happened in January is when he decided to go.
Okay. All right.
So for her, I know that she's pretty much homebound. When she's and it's the daughter-in-law that's doing the majority of the caretaking. So when she, forgets to use the bathroom, and it's, everywhere all over the house, it's the husband calling the daughter-in-law, can you come over and clean it up? They're calling her like at 2 or 3 in the morning to come and deal with incidents like that. So I know pretty much, other than going to the doctor's offices, that she's pretty much in the home.
Okay, so she's there for she's homebound for cognitive reasons and not because of mobility reasons. She's ambulatory, it sounds like. She's incontinent.
Yes.
She's incontinent but needs constant supervision, and she's dependent in all her ADLs.
Yes.
Okay, she's verbal though.
Yes.
Okay. All right. Well, that's helpful. And do you know if any of the local sons who acknowledge that there's a serious problem here, or the daughter-in-law for that matter, would be willing to serve as guardian?
Ooh. I think one of the sons locally would, definitely.
We know that there would be conflict in the family from the person who lives furthest away, and that's often the case. Of people furthest removed from the situation have the least understanding of it. But one of the local sons or the daughter-in-law might be willing to confront the family conflict, but do what's necessary, which likely would be get guardianship, unless the husband's insight and willingness to accept the help that he needs improves rapidly. But I'm not, I don't have high hopes for that. So I suspect that one of the other family members will have to assume guardianship.
Mm-hmm. You could override that.
And I think I think that if you or the primary care provider can if someone on your staff or the primary care provider can complete a PP505, well, I don't know, actually it's not called a PP505 in New Hampshire, but the form that's needed to alert the probate court that guardianship is recommended, then the judge can decide the most appropriate guardian. And I suspect he or she would choose one of the local sons or the daughter-in-law. And that might give you some influence over services and so forth.
So in New Hampshire, I'm not familiar with that form. I know that there's a form to waive the appearance of the award, but as far as I know, there's no form like that. I just maybe not familiar with it, but also when petition for guardianship is put through, that all family members, well, the sons, all siblings, and her husband and brothers and children are informed about the hearing, so all of them can go to that hearing. And
Right, that would be good, and then the judge could make the appropriate decision as to who's the best person for guardian.
Right.
And I'm cognizant of the fact that it didn't sound like Cliff was just asking questions, but he was.
There were questions.
Since we're still in the questions and not recommendation period.
Yeah, sorry, Jess.
That's okay. That's okay. But I do want to ask if there are additional questions before we move into recommendations. And I actually have one, which is a two-part question. One is, do they have access to high-speed internet or broadband? And if they do, are there telehealth services that might be available that might assist?
So I don't believe they do, but we have access to telehealth in our offices. It's limited to what some of the telehealth services are, but that could be an option. I don't believe that they have it at home.
Hi, this is Molly Dugan in Vermont, and I had a question. I'm curious about the husband, if he has any friends or peers that is a possible resource for him. And I just raised this because I know family dynamics can be so difficult. And sometimes it's, you know, a friend or a peer that can come in and kind of state obvious, but it can be heard differently than when it comes from a family member.
The only other person that I know that he has contact with is his brother, but his brother lives in Massachusetts. So he's is in frequent contact with him. But locally, I don't know of any friends or anything, because they're like, if he wants to get out and do something, there's really not anybody that can come in and help him. Right, make sure everything's okay at home.
I don't think the brother can come out.
Yeah.
Some issue with the brother.
Yeah.
I think. Yeah. But we still have speakers.
So additional clarifying questions before we move into recommendations.
I have a question.
Go ahead.
Does the daughter-in-law mind coming over and cleaning up incontinent problems?
Initially, I don't think so, but as it's progressed, like to nightly calls, it has been. It's put a strain on her relationship with her husband so much that they recently separated, but did get back together. And she's dealing, her and the son basically are dealing with their 13-year-old daughter who has cancer. So who is going through cancer treatment. So in the last couple of months, it's been really difficult for her.
So has she continued? I'm sorry, I forgot to say this is to Don. So is she continuing to perform that function, or has she stepped back?
No, she's continued to do it.
Okay, thank you.
Other questions?
Does the patient recognize family members, and is it only strangers that she is adversive to?
So sometimes she'll be able to recognize her sons and her husband, but it's not all the time. So from what I understand, when somebody comes into the home, she feels like they're there to take her. You know, they're going to bring her to her nursing home. Or I know when some folks were in there to help them with the furnace, initially she was okay, but then when it started to talk about money, she got very upset. Didn't want anybody knowing about their money situation.
This is Mark.
Hello.
I have a question about, someone mentioned earlier the idea of a family meeting. And so my question is there someone, one of the therapists or someone who could facilitate that? I think that would be critical.
Yeah, I think that could definitely be an option.
Meg London, are you on and are you able to ask your question directly?
Meg London was having issues yesterday trying to get her sound to work. We worked at it extensively, but we weren't able to actually do it.
So she has asked. Yes, we can hear you, Meg.
Okay, because I might get cut off on the phone now because I've been cut off about 5 times during the conversation. That's why I typed it. So I think for me, just what I typed in the question is fine. Like what?
So
I just don't understand how her safety with someone who's as incapacitated as she is, that her safety would hinge on her husband, who seems to have issues of his own, and various family members can't agree. It just seems like guardianship would be more straightforward. But, you know, that's a learning curve for me.
Hello, this is Jennifer in Wilmington, Vermont.
Hi, Jennifer.
Hello, Jennifer. Go ahead.
We were wondering if the client was a veteran.
No.
Okay, and are finances a barrier in this family situation? You know, or how is that impacting their decision making?
I think for nursing home placement, I think it is a barrier. And again, for me, I only know the financial piece from trying to help with the furnace. So, and they were over income for those to get any services for help with that.
Has any evaluation been done of the father's cognition?
Ooh, he refused it? I think so. I think he refused it.
So it's thank you all for your engaged questions. And it's, as my timer is telling me, it is time for us to shift to recommendations. And so at this point, we will go back to our spokes, and then we'll go back to our faculty. So we'll start with spokes and any recommendations you have for our case presenters today.
Hi, this is Leslie Funo. And I guess the first thing I would say is that it sounds pretty accurate, the previous speaker who said that this is not safe. And I think that it's really critical, the guardianship is critical. I also think it's critical to have a family meeting to talk about that reality and talk about how they can, if they're going to try to keep her home, what they need to do. And it's pretty clear that some way they're going to have to introduce new caregivers into the home, that the husband isn't going to be able to do it. And the sons have to sort of step up, I think, in that regard and address that. So they're going to have some support to be courageous to confront dad and perhaps the other son. So I think the family meeting is critical, and getting some reality into the family situation about the potential for this to have any long-term success at home, because otherwise I think it's inevitable she can't stay home.
Additional recommendations from our spokes communities.
This is Sharon. I would really like to see if he would be more responsive to husband. The husband. If he'd be more responsive to a male, either a clinician or a worker, depending on his age, depending on his cultural background, how he was raised, all of those things. That man might have a better influence on him, and it may be taken as less. He may be more open-minded to having a male talk to him than a female.
Way up in Coos County.
We're muted.
Oh,
now we're not.
that's a great idea, but we live way up in Coos County, and we have very limited resources to that. So what's your recommendation in finding a male?
There you go, Sharon. Do you have a male volunteer that can work with them who's been through some of the similar situation that he's been in?
We don't have.
Look at the retired senior volunteer program. There's got to be somebody up there that you can conjure up.
We really don't have any of those services up here. We don't have a volunteer service. We have senior companions, but it's very, very limited.
And there's only
and they're females.
Yeah.
Yeah, this is Joy from Aroostook too. One thing that I, just because of being a caregiver myself, is that it's very difficult to be the daughter or the sister or the son, rather than, if there's a way to let the family be the family, and having some others that get involved to try to do that. So I know there were other comments in this regard, but I just worry about the family and letting the family be the children.
Yeah, that's a good point.
Hi, this is Leslie again, and just to follow up on that, I would say that I have had some success over the years in introducing a new person into a family situation like this very slowly. So you might have somebody who would come in and just get to be recognized visibly as somebody who seems safe. And she won't know exactly, the patient won't know exactly who it is, and initially may be suspicious. But if the person only comes in and brings a pie or just makes a social connection and then leaves with somebody else who is a trusted person, eventually that person may be able to have inroads, if that's an aide or a caregiver, somebody with other skills. But don't introduce the person to come in first time and do a bath.
All right. Mm-hmm.
Any additional recommendations from our spokes teams? Okay, we'll go to our faculty.
This is Ellen. I think I agree with the last recommendation of introducing somebody pretty innocuous and just kind of gradually. but I think we need the husband's support to do that. And trying to get him to agree that a caregiver is necessary and then gradually introducing them over time could really be effective. If he acts like he knows the person, then she may very well decide that she does too. So.
Thank you, Ellen.
This is Anne Marie. I was just, as I'm listening to all of this, I'm just really concerned about his, I think we've talked about this, his caregiving ability and just the burnout. You know, I don't know if he even has the capacity to, even if it's not a cognitive issue on his end, just the depression and the caregiving burden right now is going to be so significant that his ability to follow through with some of what we're asking him to do, it seems like it's beyond what he's capable of. I do agree, and as much as possible, keeping family members as family members. So even if the kids aren't in a position where they want to take on being guardian, can they at least file, and we get a private or public guardian to step in so that they can maintain those familial roles without, but still have someone who can maybe sort out the more complicated pieces of it. Because right now it sounds like safety is one of the most pressing issues. And with the wandering and the agitation, I mean, I can't imagine what he's going through on a day-to-day basis. It's got to be pretty significant.
I agree. This is Catlin. And I wouldn't even wait for the regular guardianship process. I would suggest emergency temporary guardianship.
We don't file this petition, but we would need any of this.
Hi, this is Cinda.
Just so you know, and I want to say, I don't know what the status is now, but a few months ago, there was a waiting list for public guardians in where
This is Cliff Singer. Well, I don't think you'll need a public guardian because you might have willing family members in this case, and I agree. These are all good recommendations, but yeah, I think we're past the point where people coming into the home are going to be able to provide the level of support needed for her. But one thing that might be helpful if you can't get emergency guardianship and get her moved into a supervised living setting, and I understand there's a lot of obstacles to that, especially financial as well as her own ability to tolerate a move like that. But you know, maybe a geriatric assessment would be called for. There are sometimes things you can do for incontinence that might be helpful, reduce the number of episodes, and the incontinence is a big issue here, especially for the daughter-in-law. But there may be other factors contributing to her rapid cognitive decline. Anyway, I think that could potentially be helpful. Otherwise, I like Dr. Furno's recommendation about someone coming in home, but I just don't think they're going to be able to generate the level of community support that would be needed to make this turn this into a safe situation for her. And that's why I agree that guardianship and perhaps emergency guardianship is the best course.
Yeah, so for emergency guardianship, we have to show that there's imminent danger, and we have to have an event that has happened within 20 days. And a lot of times, the courts, I find, have denied those, but typically there is a hearing within 2 to 3 weeks, so once they petition. But, so that could, yeah, they could do that. But the other thing, there's no guarantee that the guardian's gonna put her in a nursing home either, because we've run into that, where they get a guardian and the guardian doesn't really do anything, doesn't put them into a safe setting like we think they should.
And also right now, our nursing homes have waiting lists for long-term care. So, yeah, when I last talked to our co-op nursing home, their waiting list is up to a year long. To get someone in from the community.
Yeah, but maybe during the family meeting, that could be something that they talk about is what is the guardian going to do? If the guardian does petition, why are they going to do that? And what is, you know, the plan for the guardian?
Yeah, at least put her name on a waiting list to start.
Yeah.
Well, she won't qualify for Medicaid probably because of their assets, which may mean that she would be private pay, but that would open up the options of private pay residential memory care. And so there you can usually get into that a little quicker, but you know, there may not be that resource available to you within a acceptable radius.
But we do have that in like a half an hour probably.
Yeah.
45 minutes. Yeah.
Summit.
So I want to make sure that other faculty have a chance to chime in if they have things they'd like to offer.
This is Tamara Herrick. I keep thinking about the caregiver burden of not of the husband, but of the adult sons and the wife. And you mentioned that they haven't had any education around how to work with somebody that has dementia. And the Alzheimer's Association has a bunch of online modules that they could access anywhere. And I don't know if you've suggested that, if they even have internet access, but
they don't.
That was my recommendation.
The son and the daughter have internet access. I know that.
Oh, great.
This is Ellen Flaherty. Question that I have is, how engaged is the PCP? And are they local, the PCP?
Oh, both of them are very engaged. They're local.
That was my question. But I think often I find that primary care physicians do hold a position of authority with older Vermonters, for instance, and that if they're on board with making recommendations, that the older generation will really take those seriously.
And what were the recommendations when she came to Dartmouth? And did she go to neurology or she went into geriatric memory clinic?
It was geriatric. So the reason why I think she got, because there were some questioning from one of the sons that he didn't think it was dementia that she had. And that she wasn't in the advanced stages of that. He thought it was more her depression and anxiety. So he wanted a second opinion from what the PCP was saying. So that's my understanding why they ended up going to Dartmouth.
Okay.
I'm going to note that Ruby Baker from Cove in Vermont suggested that if the police and APS are not working together, that it would be good to get them on the same page in relation to awareness, coordination, and your concerns.
This is Cinda Danton. Has APS has been called?
Yeah.
They're involved.
Okay.
Yes, but not for her, for him.
For him being neglected, exploited, intimidated, abused, what, you know?
It's for him for self-neglect. It has nothing to do with her.
Oh, for him neglecting himself, okay. I think that it's really important that we not, so when you're, I support caregivers as part of my job, and it's really important to not have an agenda, because people are aware of agendas and they suspect them, and they tend to be pretty rebellious. So my advice is that I like the advice that was given by two PS people about, because I was thinking the same thing, like if people could find a way to go to the home and just get to know them better by like bringing ice cream or flowers or like somebody else said, a pie, and just sit down and talk to them about what it is they want and what it is they need, and then try and work on their agenda instead of one of our own. I find that I have a lot more success that way. I'm not big on deciding what I think should happen with other people.
I also think that if APS has been called for self-neglect with the husband, that's, as you said, that's a really different thing. But it does sound like there is some level of neglect going on, even just in terms of ability to fulfill your self-adopter. That is technically neglect, and or at least in Vermont it is. So in that case, and this is where things get tricky with APS, but in that case you can, rather than pursuing criminal proceedings for neglect or pursuing more aggressive approaches, simply by engaging investigators in a situation, you can draw to the forefront some of the challenges that are being faced, that this person has been substantiated as being unable to adequately provide a safe and secure environment for his wife. And that can sort of be an impetus for some of that conversation that needs to happen with the whole family by saying, hey, we've investigated, we've found that there's neglect. We're not saying that this is intentional, intent to harm. We're simply saying that this person is unsafe in this situation, and that can be a starting point.
Just a reminder again to folks. Just a reminder again to just a reminder for folks to mute their phones because we're getting some background noise, maybe with some kids involved, just so we can all hear the conversation. Thank you. Go ahead.
So in New Hampshire with APS, it's not substantiated or not substantiated. It's founded or unfounded. And we could certainly, I mean, this might be a catalyst for neglect, but it wouldn't be founded, because if we find he's vulnerable, we don't make a finding on him, but that might be enough to get him to listen if the report was called in for neglect, and kind of get the ball rolling that way.
Well, go ahead.
This is Ellen. I think the idea of the pulling the family together in terms of understanding what the extent of the problem is really good. And so the idea of that dark evaluation, hopefully coming back with insight as to what's going on for mom, and kind of substantiating the extent of her dementia can be helpful in getting all of the family on the same page. Hopefully they will believe what the provider is telling them. And then, I think you've got a foundation for a family meeting that pulls everybody together to try to set out a plan from the family's point of view.
Thank you so much, Ellen. And I'm going to offer one last quick recommendation, and then we're almost out of time, so we'll have Patricia wrap up the recommendations for us. But sort of going back to Arustic's recommendation related to engaging a male, I was also wondering and/or thinking whether you all have had any connection with potentially older male caregivers in similar situations that might be willing to be paired with him sort of as a mentor / friend, similar to the vet-to-vet idea of connecting someone who's going through something similar, who might be able to talk about the challenges and help talk about what helped for them. I'm guessing he would be resistant to going to a caregiver group, so maybe finding an older male in your community who's gone through something similar might be useful. So, Patricia, would you be willing to summarize for us? Or was there someone else who wanted to offer something?
This is Carol in Aroostook. I was thinking about I know there's a shortage of males where you live or something, but what about the police officer that responded and he take off his uniform and maybe visit with the man, because it sounds like, he wasn't arrested, obviously. Is there someone there that could maybe help and befriend him and visit weekly or something like that, and stay somehow involved in it? I'm thinking of restorative justice practices and who in your area might know how to do that.
Great. Thank you all very much. And we're going to go to Patricia now to wrap up and offer the recommendations that have been offered by the whole group.
Thank you, Jeff. The suggestion was made repeatedly for a team and family meeting. Suggestion was also made to find a male clinician or worker. If you can't find a male clinician or worker, also thinking about maybe engaging the police or finding a male volunteer who can go in as a friendly visitor. Introducing home service providers slowly so that they can build trust with the family before trying to implement in